and welcome to my YouTube channel. My name is Dr. Tolu, and in this video we are going to be exploring the topic why many women lose interest in sex. So if you like what I have to say, please hit the subscribe button, hit the like button, and if you have a topic you would like me to discuss sometime in the future, please leave it as a comment for me and I'll do my best to get to it as soon as I can. Without further ado, let's begin. Sex is always an interesting topic, especially when it's related to love and relationships and marriages. But sex is also something that a lot of people struggle with. One British study showed that women are twice as likely as men to lose interest in sex in long-term relationships. I think about 15% of men who had lost interest in sex in a long-term relationship. But for women, it was as high as 34%. So what that tells us is that many women, when they get into long-term relationships or marriages, over time they tend to have less and less interest in having sex. So in this video we're going to be exploring the possible causes of this loss of interest and also possible solutions or treatments. To fully understand why this happens in women, this loss of interest in sex, it is usually due to a combination of a couple of physical and psychological factors. One common reason why many women lose interest in sex is advancing age. Women, as they get older, especially when they get into the perimenopausal, menopausal and postmenopausal phases, their level of androgens, that is sex hormones, starts to drop, and also there is a gradual decrease in estrogen levels. Now, estrogen is really important when it comes to sex drive in women, and a drop in estrogen levels leads to increase in vaginal dryness. The reason why this is also important is because when a woman has vaginal dryness, then the chances of sex being more uncomfortable and painful for her are increased, because sex is usually pleasurable for the woman when she's well lubricated, but in the event that she's experiencing vaginal dryness, there can be less lubrication and the sex becomes more painful. Another common cause of loss of interest in sex in women is relationship problems. For instance, let's say in the relationship the woman feels like she's not being heard, or in the relationship there's an emotional disconnection between her and her partner, or in the relationship maybe there's something that happens and the partner falls ill and then she has to assume the role of caregiver. That can be a big stressor, and anything that causes stress in women can affect their sex drive negatively. Also, if the woman's partner starts having performance issues, or let's say giving birth to a child, this is because the stress of taking care of a child, having the child can increase our risk of having conditions like postpartum depression or postpartum psychosis, or a lot of things surrounding having a child can cause a decrease in her sex drive. Third thing we'll be looking at are sociocultural influences, like if the woman starts a new job and she's finding the job stressful, or it's taking all of her time and energy, she may have very little left to give her partner. And also, even when we think of the way the media portrays sexuality, if she's comparing herself to the standards portrayed by the media, you know, slim waist, big hips, and then she starts feeling inadequate, it might make her less comfortable, and that can in turn negatively affect her sex drive. Also, it's important to consider medical conditions like fibroids, endometriosis, or even mental health conditions like depression. If these are left unchecked, or if they are poorly treated, then they can lead to a reduced sex drive in the woman. And number 4 on my list, I'm here to talk about medications. For instance, medications that are used to treat depression. When we talk about SSRIs, they can negatively affect the woman's sex drive. Also, birth control pills, they can reduce sex drive, or some blood pressure medications might also cause a loss of interest in sex. Some of these medications work by reducing testosterone levels, or some of them even cause reduced blood flow to her erogenous areas. That can also reduce sex drive. So like I said earlier, many times when there is a loss of interest in sex in women, it is not due to just one isolated thing. It's usually due to a combination of physical and psychological factors, and that can influence the way we approach possible solutions or treatments for a reduced interest in sex in women. For those who their reduced interest in sex is maybe due to an underlying medical condition, like we said earlier, fibroids, endometriosis, even thyroid disorders, what needs to be done is to treat that medical condition. So for those who may have thyroid disorders, maybe place them on medications that can help, or if they require surgery for the thyroid disorders, or even for conditions like maybe fibroids, then that is probably what needs to be done to help her regain her interest in sex. Also, talking about medication, if you see your doctor and then your doctor finds out that it is probably or possibly a medication that you are on that is affecting your sex drive or your interest in sex negatively, what your doctor may do is to reduce the dose of the medication, or may even decide to change the medication completely. Like we mentioned earlier, some medications like medication for your blood pressure, if we find out that maybe this medication is working well for your blood pressure but it is affecting your interest in sex negatively, we might decide to switch it to another medication that can still control your blood pressure but may not affect your sex interest negatively. Hormone therapy might also be helpful, and this is especially important in postmenopausal women. For many postmenopausal women, vaginal dryness is an issue, and like I said, this is usually due to a drop in estrogen, which happens with advancing age. But what can be done in that instance is to give vaginal estrogen creams, and these vaginal estrogen creams can actually be helpful in treating vaginal dryness in postmenopausal women. Another thing that can be considered is testosterone therapy for women who may have reduced androgen levels, and one of the major androgens is testosterone. What can be done is to give them testosterone replacement. Many gynecologists can decide to recommend off-label use of testosterone replacement. Why they might do this is to help to boost testosterone levels, especially in women with reduced testosterone. And last but definitely not the least is sex therapy or relationship counseling. This can be very important. In fact, it is usually strongly recommended when couples are struggling with sex, where maybe there's some element of sexual dysfunction. Sex therapy can be very helpful. Relationship counseling as well, especially if loss of interest in sex is due to emotional disconnection or maybe the partners aren't getting along. Therapy can be very helpful and insightful. So to conclude, women are far more likely to start losing interest in sex, especially as they get older or the relationship gets longer. But that is not any reason to panic, because usually there is an underlying reason why this is happening, and once we can find the reason, then we can find a solution as well. So if you notice that as a woman you are having reduced interest in sex, it's really important for you to see your physician or your healthcare provider to find out what may be causing it, and then to also discuss possible interventions or treatments with them. This is really important because you don't have to suffer in silence. Alright guys, thank you for watching to the end. If you enjoyed this video, please leave a comment for me telling me how useful you found it. Or if you have a topic you would like me to discuss sometime in the future, also leave it as a comment for me. And please don't leave without liking this video and subscribing to my YouTube channel. Until we meet again, bye.